Do you often feel a tingling sensation in your legs, like pins and needles, or perhaps you get sudden cramps in the middle of the night? Maybe at the end of the day, you just feel a heavy aching sensation in your legs. If that's the case, be careful, because what may seem like small annoyances could actually be silent warning signs that your circulatory system is starting to decline. And if you happen to ignore those signals, the consequences may go beyond simple discomfort or difficulty walking. Sometimes it could cost your quality of life, or even your life itself. Poor circulation doesn't happen overnight. It builds quietly over time, starting with a bit of swelling, a little fatigue in the legs, then gradually progressing into blood clots, severe varicose veins, nerve damage, or even stroke. I'm Dr. William Harris, and today I want to help you understand 5 early warning signs that the blood circulation in your legs may already be compromised. Along with 4 natural vitamins that can help dissolve clots, improve blood vessel elasticity, and relieve that heaviness, coldness, and cramping that so many older adults struggle with. But most importantly, at the end of this video, I'll reveal something that very few people have ever heard of. It might surprise you, but it's the very key that has helped hundreds of my patients break free from leg pain and heaviness in just a few weeks. Before we begin, let me ask you something. What's your name, and where in the world are you watching this video from? I'd truly be delighted to know who I'm walking alongside on this journey to better health. Please leave your greeting in the comments below. If this is your first time visiting my channel, feel free to hit the subscribe button and turn on notifications so you won't miss my upcoming insights on nutrition, circulation, and how to stay healthy and strong after 60. And if you have any questions about your own health, don't hesitate to share them below. I'll be collecting them and creating dedicated videos to respond in the near future. Now let's begin with the very first warning sign, one that often appears right on the surface of your skin, even before you notice anything unusual on the inside. Sign number 1, changes in skin color on the legs. An early signal of poor peripheral circulation. One of the earliest, yet most easily overlooked signs that your circulation is starting to weaken is a change in the color of the skin on your feet and lower legs. Have you ever noticed that your ankles or toes sometimes turn unusually pale, bluish, or even show darker patches? If so, it's not just a cosmetic issue. It could be your body's way of telling you that oxygen-rich blood isn't reaching those areas properly. This typically happens when blood flow through the small capillaries in your legs decreases, meaning the skin no longer receives the oxygen and nutrients it needs. Along with color changes, you might also notice that the area feels colder than usual, and if you happen to get a cut or blister there, you'll likely notice that it heals much more slowly than normal, simply because the blood can't deliver enough immune cells and nutrients to repair the damage. Many people assume this is just part of aging, but in reality, it's your body sounding the alarm. Your blood vessels are losing flexibility, and the inner flow is slowing down. And that's just the first sign. Up next, we'll talk about those painful leg cramps that strike in the middle of the night, like something suddenly grabs your calf and just won't let go. My friend, if you're still watching at this point, I'm truly grateful. It tells me you genuinely care about your health. Please leave a number 1 in the comments below, so I know you're still here with me, step by step on this journey. Sign number 2, sudden cramps during movement or sleep. When your muscles are starving for oxygen. Have you ever been walking and suddenly had to stop because of a sharp cramp gripping your calf? Or maybe you've been jolted awake in the middle of the night by a painful leg cramp that forces you to sit up and rub the area. If these things happen often, they may not just be from simple muscle fatigue. They could be signs that blood flow to your muscles is being disrupted. This condition is often referred to as intermittent claudication. It tends to occur when the arteries in the legs narrow, restricting the amount of oxygen-rich blood your muscles receive during activity. As your movement increases, oxygen demand rises, but your circulation can't keep up. Your body reacts with intense cramps as a protective response. Many people also experience these kinds of cramps at night, when blood flow naturally slows down. While massaging the muscle might bring temporary relief, if poor circulation is the underlying cause, only improving blood flow will bring lasting results. These painful spasms are the quiet language of your vascular system, and if you learn to listen, you may be able to intervene before the issue turns serious into something far more serious. Up next, let's take a closer look at another common but often misunderstood signal. A tingling or pins and needles sensation in the legs. Could it just be from poor posture? Or might it actually be an early sign of peripheral nerve damage? Let's find out together. Sign number 3, tingling and numbness in the legs. An early warning of nerve damage caused by poor circulation. If you often feel a pins and needles sensation in your legs, numbness, or like a faint electric current is running through them, especially after sitting or standing for a long time, then it's very likely that the nerves in your lower limbs are struggling due to insufficient blood supply. Although many people assume these sensations are just caused by sitting in the wrong position or mild pressure on a nerve, if they happen frequently and without a clear cause, you should take a closer look at your circulatory health. The nerves in your legs, especially those in the outermost areas, are highly sensitive to oxygen shortages. When blood flow slows or becomes obstructed, nerve cells can become damaged, resulting in numbness, tingling, or delayed reflexes. If this condition continues, it doesn't just cause discomfort, it can seriously affect your balance, coordination, and even your ability to sense temperature changes. That becomes especially risky as we age. What's concerning is that this kind of nerve damage usually develops silently, and by the time it's noticed, many nerve fibers may already be too weakened to fully recover. So don't dismiss those minor tingles. They could be your nervous system's way of alerting you that blood flow is no longer what it used to be. In the next part, we'll move away from sensation and focus on something you can actually see with your own eyes. Cold feet, even in warm weather. This isn't just about temperature. It could be a visible clue that circulation is being disrupted at the farthest points in your vascular system. And if you're still watching this video right now, thank you for staying with me all the way to this point. I truly appreciate it. Please leave a number 3 in the comments below, so I know I'm not speaking alone and that you're still right here with me, learning about your body. Sign number 4, cold feet. Even in warm weather, when blood can no longer reach your toes. Have you ever noticed that even when the weather isn't cold, your feet still feel icy, almost like they're made of stone? Many people assume this is due to poor circulation, aging, or simply just the way they are. But in truth, it's often a warning sign that blood is having trouble reaching the farthest ends of your body, especially your toes. In a healthy circulatory system, blood is pumped evenly throughout the body, keeping the skin warm and well-colored. But when the small vessels in the lower limbs become narrowed, hardened, or partially blocked, blood can't easily reach the feet, leaving them colder than the rest of the body. And here's the danger: when blood can't get there, your body also loses its ability to heal, protect, and regulate temperature in that area. This doesn't just cause discomfort. It makes your feet more vulnerable to injury, slower to heal from cuts or scrapes, and more prone to infection. It's a common symptom in chronic vascular conditions such as atherosclerosis, venous insufficiency, or even diabetic nerve damage. If you frequently feel that your feet are colder than the rest of your body, especially at night or when lying down, don't ignore it. It's a clear message that your body is struggling to deliver blood to the outermost edges of your vascular network. But poor circulation doesn't just show up as a sensation or change in temperature. Sometimes it becomes visible right on the surface of your skin, through bulging or darkened veins that are impossible to miss. And that's exactly what we'll explore in the next section. Sign number 5, bulging and twisted veins. When your blood return system is overloading. Have you noticed bluish, bulging veins appearing on your legs, sometimes twisted, swollen, or raised above the skin? Many people refer to them casually as veins showing and consider it a normal part of aging. But in reality, these are clear visual indicators that your venous system is struggling to return blood back to the heart normally. Small valves inside your veins act like one-way doors, keeping blood flowing in the right direction. But when these valves weaken due to aging, prolonged standing, lack of movement, or underlying issues like obesity or high blood pressure, blood can flow backward or pool, putting extra pressure on the vein walls. This pressure stretches the veins, causing them to swell and become visible under the skin. This condition isn't just cosmetic. It's often accompanied by a feeling of heaviness, slight swelling, aching, or a burning sensation in the affected areas. And if left unaddressed, these enlarged veins can become sites where blood clots form, increasing the risk of phlebitis or chronic leg ulcers. Alongside large varicose veins, you might also see fine web-like red or purple veins just beneath the skin, commonly called spider veins. Though smaller, they're also signs that your venous system is under excessive pressure and blood return is slowing down. As Professor Espiger once emphasized, the biggest mistake is thinking these signs are purely cosmetic. Because once the venous system begins to fail, it often leads to a chain of complications, long treatments, difficult recovery, and persistent discomfort. So now that we've identified the warning signs, the next question is, what can we actually do to improve circulation naturally? In the next section, I'll share with you 4 powerful vitamins that have been shown to support blood flow, dissolve clots, and help your blood vessels stay flexible and strong every single day. Number 1. Vitamin B3. The nutrient that widens blood vessels and boosts natural circulation. The first vitamin I want to talk about is vitamin B3, also known as niacin, a nutrient with the ability to dilate small blood vessels and increase circulation, especially in the lower limbs. Once inside the body, niacin helps relax and expand blood vessel walls, making it easier for blood to flow through. This reduces internal pressure and helps prevent blood from pooling or forming clots. In addition to improving circulation, vitamin B3 plays a key role in lipid metabolism, helping to lower LDL bad cholesterol while raising HDL good cholesterol. This indirectly reduces the risk of atherosclerosis, helping blood vessels maintain their elasticity and lowering the chance of cardiovascular complications. You can naturally get niacin from foods like skinless chicken breast, salmon, tuna, eggs and nuts such as almonds or sunflower seeds. Just 100 grams of chicken breast can provide over 50% of your daily niacin requirement. However, one important note, if you take high doses of niacin in supplement form, your body may experience something called a niacin flush, a warm red sensation on the face and upper body. That's why, especially for older adults, I usually recommend getting this vitamin from natural food sources, which are both safer and easier for the body to absorb. And now, if you've always thought that vitamin C is just for immune support, think again. In the next section, you'll discover a powerful and often overlooked role that this familiar vitamin plays in strengthening and maintaining the elasticity of blood vessels, especially in the legs and feet. Number 2. Vitamin C strengthens vessel structure and effectively reduces vein inflammation. When people think of vitamin C, they usually associate it with immune support. But in reality, its role in the circulatory system goes much deeper especially for older adults dealing with poor blood flow in the legs. Vitamin C helps reinforce the strength and elasticity of blood vessel walls by stimulating the body to produce collagen, an essential protein that forms the structural foundation of blood vessels, connective tissues and skin. When your capillaries are supported by healthy collagen, allowing blood to flow more freely with less risk of leakage, dilation or rupture. In addition, vitamin C acts as a powerful antioxidant, reducing inflammation and protecting blood vessels from the damage caused by free radicals, unstable molecules that accelerate cell aging and make vessels more fragile. This is especially helpful for people who regularly feel leg fatigue, heaviness, or signs of mild vein inflammation after long periods of standing. You can easily get vitamin C from fruits like oranges, kiwis, guava, strawberries and vegetables such as red bell peppers, kale and broccoli. One important note: vitamin C is very sensitive to heat and light, so it's best consumed fresh and minimally processed. We've just discussed a vitamin that plays the role of a structural protector for your blood vessels. In the next section, I'll introduce you to a nutrient that's often overlooked but acts as a gatekeeper in the blood clotting process, helping prevent dangerous clots from forming in the first place. Number 3. Vitamin K regulates blood clotting and protects arteries from calcification. Vitamin K is an essential nutrient that's often overlooked when it comes to circulatory health. Yet its role is incredibly important, not only in preventing dangerous blood clots, but also in stopping calcium buildup in artery walls, helping keep your blood vessels soft, flexible, and functioning properly. Specifically, vitamin K helps regulate blood clotting by activating proteins that control the formation of clots. This means it prevents excessive bleeding when injury occurs, while also reducing the risk of abnormal clot formation that could block vessels, especially in the legs where circulation tends to slow with age. Additionally, vitamin K helps combat arterial calcification, a condition common in older adults, when calcium ends up in the blood vessels instead of the bones. This misplacement of calcium makes arteries stiff, reduces elasticity, and increases the risk of high blood pressure and poor peripheral circulation. You can effectively get vitamin K from dark leafy greens like kale, spinach, arugula and broccoli, or from fruits such as kiwi and avocado. A helpful tip: since vitamin K is fat-soluble, it's best absorbed when paired with healthy fats like olive oil or avocado. And if you're currently taking blood thinners like warfarin, don't worry. You don't have to completely avoid foods rich in vitamin K. What matters most is keeping your intake consistent each day, so your doctor can adjust your medication dosage accordingly. Up next, we'll explore another familiar vitamin, one with a unique ability to soften vessel walls, fight oxidative stress, and support natural blood vessel dilation, making circulation smoother and more effortless with every heartbeat. Number 4. Vitamin E, the antioxidant shield for your blood vessels and a natural support for vessel relaxation. In the world of micronutrients, vitamin E is widely recognized as a powerful antioxidant, but what many people don't realize is its positive impact on the circulatory system, especially for older adults who experience sluggish blood flow, cold feet, or frequent leg cramps. Vitamin E has the ability to neutralize free radicals, molecules that damage blood vessel walls and accelerate vascular aging. When the inner lining of arteries weakens, blood flow becomes less efficient, and clots are more likely to form. Thanks to its antioxidant properties, vitamin E protects and preserves the elasticity of vessel walls, helping reduce the risk of stiffening and chronic inflammation. But that's not all. Vitamin E also helps the body produce nitric oxide, a compound that naturally relaxes and dilates blood vessels. When vessels widen, blood flows more easily, the heart works less hard, and there's a noticeable lightness in the legs, especially at the end of the day. You can get vitamin E from everyday foods like sunflower seeds, almonds, avocados, extra virgin olive oil, and green leafy vegetables. However, high-dose vitamin E supplements are not recommended, as they may increase the risk of bleeding. The safest and most effective way to benefit from vitamin E is through a diet rich in whole, natural sources. So now we've explored 4 essential vitamins that support better circulation. But if you're wondering, where should I start, and how can I actually make these changes in daily life? Then the next section is exactly what you need, a simple practical guide to get you moving in the right direction. Part 3. The combined power of 4 vitamins. A complete support system for healthy blood vessels. Now that you've seen the individual roles of each vitamin, let's take a step back and look at the bigger picture. Vitamin B3, niacin, acts as the path opener. It widens blood vessels, improves flow, and helps blood circulate more efficiently. Vitamin C serves as the structural support, strengthening vessel walls by promoting collagen production and reducing inflammation. Vitamin K is the coordinator, preventing dangerous clotting and managing calcium buildup in the arteries. And finally, vitamin E acts like a shield, protecting vessel cells from oxidative stress and keeping them flexible by supporting natural vasodilation. When combined wisely, these 4 vitamins create a complete defense and recovery system for the circulatory network. Especially in the lower limbs, where gravity, prolonged sitting, and chronic conditions like diabetes or high blood pressure place the greatest strain. The good news: all of these powerful nutrients can be absorbed through your daily diet. You don't need expensive treatments or complex regimens. Sometimes, a green smoothie in the morning or a handful of seeds in the afternoon can be the smartest investment in your long-term vascular health. But is changing your diet alone really enough? In the next section, I'll guide you through the simplest first steps, things you can start doing today to gently but effectively reactivate healthy circulation in a sustainable and safe way. Part 4. Where to begin? Small daily changes that improve circulation. After learning about the vitamins that support healthy blood flow, you might be asking yourself, where should I start? And the answer doesn't lie in some complicated treatment or overwhelming routine. It begins with small, practical and sustainable steps, changes that fit naturally into your daily lifestyle. First, get into the habit of listening to your body. Any sensation of tingling, cramping, heavy legs or cold feet should be noted, because these are your body's early signals, a kind of internal map revealing potential circulatory issues before they escalate.